Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also tuning in to our friends at iHeartRadio and Amazon Music Podcast. Glad you all could be with us as well. This is part of our News You Can Use segment here at WYAD, and today we're talking about breast cancer, in particular, metastatic breast cancer. It is the most serious form of the disease and occurs when the cancer is spread beyond the breast to other parts of the body. Though there is no cure, there is an opportunity, though, to be able to extend life and to be able to have some positive results, and that is because of new treatment options. We're excited to welcome back to our program today Dr. Denise Yardley. She's the Assistant Director for a Breast Cancer Research Program at Sarah Cannon Research Institute, and she's joined today by Sue Friedman, who's the Executive Director and founder of Facing Our Risk of Cancer Empowered, or FORCE. I want to talk to them not only about this treatment option, but also information you all can use as well. Thanks to the two of you for the time. Really do appreciate it.
Thank you.
Sue, I'm going to kick things off with you. I appreciate you being with us here. What does a diagnosis of metastatic breast cancer of MBC, what does it mean for a patient?
So a diagnosis of MBC can be devastating for the patients, but also for their loved ones. And it's important to know in the United States, metastatic breast cancer takes a life of both men and women about every 12 minutes. When faced with incurable disease, the hope for metastatic breast cancer is to live as long as possible, but also as well as possible. And to do that, it's important for patients to be their own advocate.
So we appreciate you being with us. Talk to us about FORCE. What exactly is the mission of FORCE?
Well, thank you for asking. FORCE, FacingOurRisk.org, is a national nonprofit organization devoted to people and families affected by hereditary cancer, so people with an inherited mutation that can increase their risk for cancer.
Thank you for that. Dr. Yardley, it's glad to have you back with us to talk about this important topic. What does overall survival mean in the context of MBC, and why is it significant for patients?
Well, overall survival is really the most meaningful endpoint we look at treatment options for patients facing a diagnosis of metastatic breast cancer. And what that means is we're significantly prolonging this patient's lives. And this gives us an opportunity to find additional treatments and even cure. And on a patient level, it allows them to spend more time with their family and doing the things that they want. And so when we look at treatment options that have an overall survival advantage, such as KISQALI, that's the only CDK4/6 inhibitor that's been shown in 3 large randomized trials to improve overall survival in patients with metastatic breast cancer, we really have a great, meaningful endpoint with the addition of KISQALI to standard anti-estrogen therapy. And it's paired with a great quality of life as well. It comes with side effects of lowering the white blood cell count transiently, or some nausea, vomiting, constipation, or diarrhea. Patients can have some hair thinning, a rash, or fatigue, easily adjustable with changing the dose of the medication for patients. And so offering this as an option to partner with their anti-estrogen therapy allows these patients to experience the potential of a median overall survival of greater than 5 years in a patient with metastatic breast cancer.
Wow, such great information. It's great to know that KISQALI is able to do that. So to that point then, I mentioned even in my intro, and even when Dr. Yardley was mentioning about the benefits of KISQALI, when we think about quality of life, extending life, that's one of the things, of course, that's so important. Beyond just overall survival, though, Sue, what does improving a patient's quality of life mean for them and their loved ones?
It's so important for patients to understand from their doctor how treatments will affect their daily life, their work and activities they enjoy, including spending time with their loved ones. We also suggest that metastatic breast cancer patients share their priorities and preferences with their doctors and make sure that they're heard.
Love that. So, Sue, what are some of the questions then patients should ask their doctors about their treatment plan? Because there are other treatments out there, but what questions should our audience be asking?
Well, patients should ask questions and be ready to have an open discussion with their healthcare provider once they get the answers. Some of the important questions are, what tests have been ordered for me, and what were my results? What do they mean for me, and what are my options? How will the different treatments affect me and affect my quality of life? And is there any additional testing that may be needed to help me make a treatment decision? I think it's really important to make sure that your healthcare professionals know if you're not understanding what they're telling you, because medicine can be full of jargon, and so it's important to ask questions until you understand what you're being told.
Yeah. So to that point then, Dr. Yardley, you talked about KISQALI and what it's able to do. What do you want our audience to know about this particular treatment option and how that should fit into, as Sue has mentioned, that open dialogue, how that should fit into the dialogue with their doctors?
So I think, I've always encouraged patients to have the shared decision-making and when they're facing a diagnosis of metastatic breast cancer, know what treatment options are available and look at the endpoints of some of the treatment options, so such as KISQALI that offers a meaningful overall survival advantage. What does that mean to the patient? And what does the partnering of the side effect profile? So KISQALI has an excellent, easily manageable side effect profile. It's an oral therapy that patients can take in the convenience of their home. And so I encourage patients to really reach out to their healthcare provider to see if this is an option for them or other options to explore, keeping those endpoints in mind, because overall survival is the most meaningful endpoint we can have with metastatic breast cancer. And we also, encourage patients to look at websites for KISQALI. They can look at www.KISQALI.com. They can look at breastcancer.org. They can look at facingourrisk.org. So all, ways for patients to kind of get empowered with the shared decision-making of looking at their disease and options for treatment.
Some great information. I really appreciate the two of you breaking this down for our audience. Again, everyone, we're glad to welcome back Dr. Denise Yardley to our program. She's the Assistant Director for a Breast Cancer Research Program at Sarah Cannon Research Institute, and also Sue Friedman is with us as well, the Executive Director and founder of Facing Our Risk of Cancer Empowered, or FORCE, talking to you guys about not only metastatic breast cancer, but also a treatment option to help extend life and the quality of life as well. Dr. Yardley, appreciate you giving out those websites. Sue, if you don't mind, let our audience know again how they can stay connected with FORCE.
Yeah, FORCE is, you can go to the FORCE website at facingourrisk.org.
Thanks to the two of you for the time. Really appreciate it, and looking forward to speaking with you again.
Thank you.
Thank you.
More than welcome. And we thank your audience for tuning in to another great segment of Conversations Live. Again, part of our news you can use here at WYAD. Appreciate you all being with us. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live, and let's go make today amazing. Take care.